A very, very important and a very famous case study I have for you, that was for canagliflozin. So this was by Johnson and Johnson, and the indication that it was done for was heart failure. Okay, so what was done by Johnson and Johnson? So they started. So this was the first time that anyone started with DCTs. So they started with wearables. You must be aware what are wearables. Wearables are the devices which you can wear. Like you have a common thing like your pacemaker, wearable watches, and then you have your smart watches also. There are various wearables that are coming in the industry now to monitor your blood pressure, then heart rate, everything. So this was a study conducted by Johnson and Johnson for heart failure indication, and the drug was canagliflozin. So here they were able to put a wearable on the patient's body for their first visit. So visit one we know is usually uh, the kind of visit where the patient signs the informed consent. Once the patient has signed the informed consent, the patients were allotted the wearables. Now we know in traditional clinical trials, patients have to come in day of the visit after whatever is the duration of the frequency of the trial, whatever is the trial design. So either a month, after 15 days, patients have to visit the site. There is some waiting period. They have to run certain tests. They have certain questionnaires to answer. And one or two poor CRCs at the hospital, they are overburdened. So this was a wonderful initiative done by Johnson and Johnson. So they gave wearables to the patients on the day of the informed consent. Once the patient is clean and found potential or eligible for the study, they were given these wearables, which monitored their heart rate and their activity. How sedentary is their lifestyle and how active is their lifestyle. So this was first wearable trial conducted, and then there was a app provided and access provided to them, wherein whenever they like had their visits, they need not come to the site, need not come in physically. So they were provided their login credentials, so the PI or the investigator would speak to them, and they would ask like what are the adverse events, or whether you had any issue, report any incident. So this was the first one of its kind DCT. Then real-time data transition. So if I'm sitting at one place, you all are uploading something on a cloud, and I'm able to see everything because you all are uploading all the data on cloud. So I am having access to all the real-time data. Sitting globally, I can have access to all the patients' data that they have entered, if they have any adverse events, any issues that they have reported. So this is one of the DCT's perfect example, which you can always keep in mind. Thank you for this opportunity and this stage to interact with you all. It's a pleasure. It's really an opportunity for me to uh, coordinate with you and speak for you all. So thank you for this opportunity, Clinilaunch.